Maybe your roommate? What about your best friend? You could just dial 1-888-TAXI-GUY or use the Taxi Guy app. The call and the app are free, and they both connect you to a local cab company to bring you home safely. Visit arrivealive.org to find out more. Arrive Alive, drive sober.
This is Rogers TV.
Hello and welcome to the special edition COVID-19 program. My name is Carol Merton, and today I am pleased to welcome two guests to our program. I have the Owen Sound Police Chief Craig Ambrose, and also with our chief, we have Jason Cranny, who is the Community Service Officer, and again, with the Owen Sound Police Services. Welcome to both of you. Now, I want to explain to our viewing audience that you're both in the same room, but we recognize the importance of masks. So when one is speaking, the mask will come down, and just because of muffling of sound, but we are following the guidelines and protecting everyone to the best of our abilities, but still trying to get this message out. So thank you to both. I couldn't imagine that we're still talking about COVID-19. I almost feel like now we're dealing with the Omicron edition. Before it was a Delta variant, but I'm wondering if you can talk about the police services and some of the impact, certainly with COVID-19 and community safety. Who would like to go first?
I'll maybe start. So, yeah, it's, going on 2 years now. Who would have thought that we'd still be in this position at this time when we first started? But obviously we are, and we deal with what we're given, and we have to make the best of it. But certainly there have been challenges, and the community has responded to those challenges, and the police service has responded to those challenges. Probably the biggest is that we've never been in this type of an ongoing emergency and situation, and the demands on our members are probably the most significant, because not only are we dealing with everybody else's problems and concerns and everything to do with the pandemic, but our own members have their own issues, problems, concerns, and that was very apparent in the last few weeks and over the Christmas holidays when numbers started to skyrocket with the Omicron variant, and changes to the testing protocols and all of those things, and the police services in Grey Bruce weren't immune to that, and we have to have enough people here, and we have enough people available to staff for the demands for service that we have, and that was probably the keep me up at night type of thing right now. That how are we going to do that if we reach a target of 30% of our people who are off sick, which is what we were told to prepare for at one point, and fortunately, everybody's using masks and being careful and washing hands and using hand sanitizer and between calls, because not only are we concerned about getting and contracting the virus ourselves, but we don't want to be in a position where we respond to a call and we give somebody else the virus because we have somebody who's sick at work. So anybody that's not feeling well, they're told to stay home, self-monitor, all of those things. So we follow all the same public health guidelines, but at the same time, it makes it difficult to staff. And the numbers seem to be getting better now as opposed to worse. So hopefully we're moving beyond that.
One of the things that we notice as we were moving through the pandemic is, people, their stress level is higher and their tolerance level seems to be much lower. So, first responders and police are absolutely there 24/7. Are you finding there's a difference when you are approaching people because of those higher stress levels, whether it's, the tolerance level or the urgency of the calls or the mental health calls? Is there a change because of this?
So I'll probably tackle part of that, and then I'll turn it over to Jason. But I think it's safe to say that the number of calls that we've received in relation to regulations and guidelines, and we're not obviously the front line in responding to those types of concerns, but we do deal with any conflict. So even though enforcement of masking and all of those things don't fall on the police, ultimately, if there's a concern, somebody calls us, we go and we respond. Those are the types of things that we've seen an increase of We've seen, shortness with people in public. So yeah, we've noticed that. And then mental health for sure has been something that I don't think we've seen. I think we might have just seen the tip of the iceberg when it comes to mental health, as far as what the effects of the prolonged lockdowns and restrictions and everything are. And I think that was the important message with the schools. What the last thing they want to do is close the schools again, but with the concerns and the numbers the way they were, that was the only option. And I think you see that they brought the schools back as a priority because of all the messaging that's come from the science tables regarding mental health. Especially when youth and adolescent mental health and the routine that the lack of routine that they've been suffering from, I think is something that, yes, we're seeing it now, but my concern is how are we going to see it manifest in the future, and I don't think anybody knows that.
Yeah.
Jason?
Yeah, I know in my role, Carol, being out in the community with regularity, and certainly in the fall, it seemed a little bit more normal than it had in a while. And it was quite refreshing to actually see people in person and actually attend a couple of meetings in person, and certainly, meeting with students and staff. Our seniors population, which for the first year seemed like something we weren't able to do with regularity unless we were doing stuff on a Zoom call. There's generally a level of frustration, I think, this time around, which is understandable, and that's no fault of anybody's, really. It is what it is. And I think it's just that sense of being confined. That's a tough thing for people to comprehend. So going back to the Chief's point about mental health, I don't even know if we're really going to be able to flush out how much all of this and how much toll this has taken on, our general population, or certainly our local population, which we're a microcosm of, our larger population. And I would say more specifically, even into our seniors and our youth, specifically our youth, knowing that structure and clear limits is kind of a best practice for them. They enjoy it, they need it. And though there's rules in place, they can't do this, they can't do that, they got to stay home, they can only hang out with so many people. The fact that you cannot go with regularity and connect with your friends and your peer group, your teachers, your coaches, to be on the ice, to be in the gym, to go to the movie theaters, that's tough. So there's definitely been some stresses on our frontline officers. I don't think, for a lot of cases, people mean to be. I just think they're generally, it's tough. And so we've certainly had to deal with it in that regard. Fingers crossed, after today's announcements, we've said this before, but that things will start to ease up and get a little bit better. And it certainly takes a burden off frontline staff and emergency services for sure.
And you're referencing the announcement that we're going to be gradually starting to open with more groups numbers and also, restaurant capacity. So just opening up a little bit more as a gradual reopen, which is positive news. I think there's a lot of people holding their breath about that, and just fingers crossed that, it will continue to be successful. So I understand that there has been a company that's provided filter systems for the station, and also various businesses that have shown their appreciation. I wonder if you'd like to speak to that.
Do you want to start, Chief?
Yeah, so I'll start. Certainly, we were looking for opportunities to make the healthiest and safest place that we could for our employees, because we don't have the option of closing the doors and sending people and allowing them to work from home and those types of things. We need to be here. We need to serve the community. Although, we would love to be able to extend that to our employees. It's not a possibility. So we talked about how do we minimize the risk of exposure and minimize the risk of transmission in the building. So we started looking for some options for some air purifying systems, medical grade, so that, especially with Omicron, because the spread was so much different than the previous variants, where masking really helps, but then the information that we were getting was that just 15 minutes in the same room, or somebody in the same house not even in the same room, it's airborne and it's smaller particulate and everything else, that the risk of transmission was that much higher. So we started looking at some opportunities, and one of the local, not even a local business, but we reached out to try and find some equipment, and the company from Kitchener-Waterloo provided us with, when we reached out, they provided and offered it to us, recognizing role that we play in the public and the importance of that role and the role that our dispatch center in particular provides for, when we serve a population of 300,000 people through dispatch, and realizing the importance of those people staying healthy, staying well. They actually donated the equipment to us. And that was a welcome donation. So, you may have seen that on social media. Jason put that out earlier this week or on the weekend. But there's been all kinds of other local businesses as well. And I don't want to get into naming all of them and doing the publicity for everyone. But certainly, we've had meals dropped off. We've had service groups drop things off. We've had all kinds of letters of support. Jason is kind of the focus for all that, so I'll let him go through some of them, and we will provide a shout out to the air purifying company. So.
I don't, it's when people drop off something, and sometimes it's anonymous, and sometimes they let us know what they're doing, and it can be simple. I mean, it wasn't even simple. It was a great gesture with the air purifier, the air purifying equipment that we received. That in itself, it really does. It picks up morale when you know that. When you can't leave, restaurants are closed, you can't go out, and you are here and you're stuck here. We, because it's a 24/7 operation, much like the hospital, when you're here, you're here. And so when you know that other people care genuinely about the safety and well-being of our members as much as we try to care about the community, it makes a big deal. When someone drops off, yesterday as an example, the United Way and Galaxy Theaters dropped off popcorn. They were going around to different businesses and they were dropping off random max of popcorn. I think that's what it was called. And I mean, it just puts a smile on the face to the members to know that people care. And we have had such great partnerships with our community and our community members. It does make a difference. It makes a difference to morale. It makes a difference to the spirits, and to know that people, generally think of us, because, as when I'm out talking in the community, my job is a little bit different than the average officer when they're on the front line. Usually when people call in, they're not usually good, positive calls. People don't call and tell us about all the great things that they've done, and that's part of the job. So there's certainly, a negative slant that comes when you have to deal with a call, and not everybody wants to see us, quite frankly. So it means a lot to us when people think about us and our members, and particularly our civilian members, who are here for their 12-hour shifts. And when you're in the comm center, as the chief had mentioned, we service a lot of different emergency services across the province who depend on us, and we need to have this staffed and facilitated 365 days a year. So it's really important and imperative that they're fed and that they're healthy and that they're safe. So a great shout out to, as the chief said, you can't mention everybody. I wish we could. I should have probably had a list in front of me, and I don't. But we certainly try to put a shout out on social media so that when we do know that people get the recognition that they certainly deserve, because we really do appreciate it.
Were you surprised when this started to happen? Were you surprised?
Living in Owen Sound most of my life, and working in a few other spots, the one thing that I can say with confidence when I go throughout the province is people are generally amazed at the collaboration and the coordination of the partners that we have. It can include a myriad of different organizations. Sometimes we agree to disagree. We don't always, come to the same conclusion at the end. But I think the respect of the fact that, we are the urban center. Owen Sound is for basically you have to go 2 hours outside of Owen Sound before you meet the next urban center. So we have a lot of big city problems that happen here, and we don't have the staffing capabilities. And whether it's here at the service, or whether it's at the hospital, or public health, or the United Way, or Mawikwadong, we can pick any organization because you're funded accordingly. This is a hub, so a lot of people use our services. So to answer your question, it certainly is nice, but because Owen Sound's such a great place, I'm not surprised because people do think out of the box, and they do think of those of us who might not be able to work from home. I'm not saying everybody likes to work from home, but you might feel a little bit more safer working from home than when you're coming in and out of work. So I guess it's certainly a pleasant surprise, if you will.
Yes.
And just to follow up on that, it's probably, it wasn't a surprise that there were as many people that were supportive, and we were so well supported in our community. But even just the gratitude of every day, there's somebody dropping something off almost every day, whether it's a note or a paper or something. And that's the part that surprised me. And when we went out looking for these air purifiers, it was a significant donation. They donated more than what we asked for, and Austin Air provided those air purifiers, and not just for the rooms that we were concerned about originally, but for most of the stations. So that was significant.
Yeah, you mentioned about we're a city, and we do have big city issues. This pandemic has had an impact on other concerns, opioid crisis, and also those who are living precariously without homes. And I'm wondering if you could talk about what you're seeing in relation to those issues, and how Omicron has affected, and not just Omicron, the COVID-19 pandemic generally.
You want to start, Nick?
Yeah. Certainly, the fact isn't lost on me that the number of deaths on Grey Bruce and probably on Sound, although we don't have that breakdown from opioids, is higher than the pandemic. So when you think about the priorities and the seriousness of the pandemic, we're in the midst of two. We have another issue, and that's the opioid issue, and that needs to be addressed. But we can, public health, they're drawn as tight as they can right now with the pandemic. So how do you focus on two health crises at the same time? But it's something that we really can't lose focus on, and people have to realize the significance of the opioid crisis and how we're not dealing with it right now because we're trying to get through this. And every day is another battle for somebody out there dealing with some type of a dependency, and it's a medical issue, it's a medical crisis, and a health issue. And as you said, the health issues, they're determined on a number of factors, and that's homelessness, that's addictions, it's mental health, it's poverty, it's access to care, it's all of those things that we really have to look at to provide wraparound services to everyone. And until we get to the point where this is dealt with and we can move on to the next and hopefully come up with some strategies to deal with that. There are a lot of people that work really hard, but we can't do everything all at once. And I think we all have to work together to come up with some ideas and some progressive actions to move that forward. And, you see what some other communities are doing, and there's no reason why it can't be replicated here in Owen Sound. As far as addictions, mental health, and helping the community and helping those that need the help the most. So it's coming.
For sure, you've raised some absolutely critical points. You clearly stated this is a medical issue. It is a health issue, which, it's important to recognize that this is, just as we would help anyone else in a health crisis, this is a health crisis, and the true picture may not be completely evident until we start to move through and move beyond the pandemic. The other thing that has impressed me so much is how much the police services sit at community tables. It participates in safety and well-being planning, and it's it's not just enforcement. It's very much a community service. Jason, I'm wondering if you wanted to speak more about the community service aspect.
It's imperative. As the chief had mentioned, when you're talking about opioid issues and homelessness, and there's home takeovers, and there's mental health, and there's a whole myriad of different issues that people in society struggle with. And unfortunately, due to some of those situations, people make choices that sometimes end up being criminal in nature. and we end up dealing with some of these individuals. And it's part and parcel that we learn as much as we can so that we can provide the best, the best service to our citizens, because safety is paramount. But at the same time, we all want to make sure that there's care and compassion when we are actually doing our job. So, there's one thing to type out an email, but when you can sit at the table and you can, work together, as I said before, collaboratively, ultimately, that's the best result that you can possibly have. And sometimes there's different viewpoints at the time, and usually somewhere in the middle is some kind of commonality. But to get there, you have to be at the table. You have to be at the meetings, and we are committed to doing that as best we can with the people power that we have, is to be as many places as we can and to learn as much as we possibly can, and to transfer that knowledge on to our officers, because a frontline officer, when they go to a call, they don't know what kind of call they're getting each and every day, and it changes so quickly. When we talked about COVID off the start, and that's what this is all about, the rules are changing ever so quickly. But also, the issues and the situations that happen on an ongoing basis. An officer has to be ready and has to have their toolkit, stocked up and ready to go. And that's part of my role, is to make sure that they have the resources available at their disposal when possible, and also to transfer the information that is important to them when they're working in the community. And we're doing a lot more with our homelessness outreach program, working with our community partners. And once a month we go out with Y Housing and sometimes the county of Grey, interacting, talking to people who are struggling, they're homeless, letting them know that we're here, reminding them that their support's available, that we're working in collaboration with Y Housing, and ideally we want to get them into somewhere safer, if at all possible, in a shelter environment with a roof over their head. So we do that. Usually we go out once a month with them to make sure that we are interacting with people, on an ongoing basis.
So it's definitely proactive, not just reactive to issues that you're called about. You're actually out there.
Carol, quite frankly, it has to be proactive. I mean, most of our job is reactive because we get the calls and then we have to go out. But to do it as effectively as possible, we have to try to be as proactive as we can. And to do that, it's important that we're sitting at the table and working with our partners whenever we can.
I think it's important to stress too that the police are the social agency of 24-hour response, and the fact is that majority of the incidents and calls that we get for service have nothing to do with the police matter, and that they're social calls. They're dealing with other issues that nobody else is doing and dealing with. So who do you call? You call the police because the police are working. So you need to have that, like when Jason said, we respond to a call and we don't exactly know what's going on until we get there. There's a lot of the times that we are the referral agency. We're the touch point where we have the first opportunity to bring other people into that person's life and situation to try and make it better. And we have to know what's out there. We have to know how to do our job and provide them with that. And even with the CMHA and our partnership with CMHA, running the mobile mental health addictions response team, and our core officer downtown working with all the agencies. The people that we're dealing with, and the people that you mentioned with mental health addictions and homelessness issues, those are the people who are victimized at a higher rate than the normal population. So not only are they do they need assistance with one or more problems, but they're the people that other people are taking advantage of and are causing to have victimization. So we need to work with those individuals. We need to earn their trust, and that's what we try and do by doing it proactively.
I've heard the phrase "no wrong door," and what you're describing is whether the police are the first interaction to help guide someone to the appropriate services. There's no wrong door to get help, and the police, the role is to help also to guide individuals. We have a few minutes left in the program, and I'm wondering, there have been people who said, well, people are out in the street or they're, doing things. Why don't you just keep them there? Why, there is that catch and release issue at this point in time. You're not able to keep people because of COVID. That's created a whole other issue for the police services, correct?
Yeah, so I mean, we can go out and lay a charge, arrest somebody, find them committing an offense, and then the best part of our justice system and the reason why it works as efficiently as it is that's the end of our role and that's the end of our involvement in that case. We present it through the Crown Attorney, but we lose carriage of what happens to it. We don't decide on punishment. We don't get involved with that. The Crown Attorney looks after that. The judge makes the decisions. So anybody who, even if we arrest them and they're charged with an offense, they're entitled, they must be presented before a justice of the peace within 24 hours or released immediately. And there were so many people incarcerated who had never been convicted of a crime, just on pre-charge custody. That and especially it became especially apparent with COVID that the numbers in custody that had to be revisited. So the justice system are the ones who make those decisions on release and things. So yes, if if one of your callers is saying, well, the police arrested that guy yesterday and they let him out and he's on the street, it's not the police. We are bound by the rules and rules that we're provided with through the courts and through the justice system. So yes, we may have to release that individual, or we may actually have kept them in custody and they've appeared before a justice and the justice has ordered them released. And yes, there is a bit of a revolving door, and there are a number of people that may be out on a number of conditions, but that's the system that we work with, and that's the beauty of the system is that it works, and it only convicts those that are guilty of crimes. There's the odd one that might get through that, and those are the ones that you hear about, but generally, we're a piece of the system, and we don't control the system, so that's one of the strengths of it.
And I think that's really important, that people understand, the role and the responsibility, and that you're an important part of an even larger system, but not all the decisions fall on the shoulders of the Owen Sound Police Services. We have about 1.5 minutes left in the program. Is there anything you'd like to really focus on and emphasize in that last little bit of time?
Jason?
I just think that just continuing to be as proactive as we possibly can and being at the table with our community partners is really imperative. And here's hoping that as we move forward that COVID does ease up a little bit, because I think that will allow us to move forward more effectively with some of these issues that we've talked about in the second half of this segment. That's kind of our hope, is that we can continue along that path and having a little bit more face-to-face contact, because I do believe that there's a lot of merit to that.
Yeah.
So that's our hope anyway.
And mine will just be 10 seconds. I want to put a shout out to all the local businesses and the ones that have suffered through closures and everything else. And I encourage people to go out and support local businesses, support local restaurants, and when we can do it again. So.
Yeah, and that's a double shout out. I'm adding on to that, absolutely. I want to thank you both very much for being on the program. The information you've shared is so critical for our audience, and certainly I continue to learn more about the services that you do. Thank you for all that you do.
Thank you.
Thank you. Thank you to our viewing audience as well for joining us today. Please join us again to learn more about how to keep you, your family, your neighbors, and your community safe as we move through this COVID-19 pandemic. Take care, stay safe.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Call the Rogers TV viewer response line. Email us or connect with us on social media.